If you are eligible for Medicare, searching through thousands of plans can be confusing and overwhelming. This morning, we are exploring what you need to know for yourself or a loved one. Joining me this morning is the CEO of eHealth, Fran Soistman. Thanks so much for coming on and being with us.
Well, thanks, Andrea. It's very good to be here with you this morning.
Okay, so there are a lot of plans, about 4,000 that people can choose from. First, let's start with the basics. When it comes to Medicare, there's parts A, B, C, D. What's the biggest difference between those kinds of plans?
Sure. Medicare Part A is original Medicare. It's primarily for your hospital services, both inpatient and outpatient. Medicare Part B covers your medically necessary physician visits as well as certain DME, durable medical equipment, and some drugs, for example, insulin pumps. Medicare Part C is Medicare Advantage. That really comprises Part A, Part B, and in most cases, Part D, which is the prescription drug program, all wrapped up in one.
Okay, so that sounds like the easiest option for now, but as people start making these considerations, a lot of people will be exploring different websites, for example, or maybe calling different carriers to learn more information about these kinds of plans. So especially for adults helping their parents as they get to be these ages where they're starting to pick these kinds of plans, what's a good starting point? What should you consider first?
Well, it's a great question, and I think it's important that to be prepared. You want to have your Medicare number. You want to have a list of the drugs that you take, the physicians you prefer. You want to put time aside. The process can take 45 minutes to an hour. And I know you referenced that there's thousands of plans, and across the nation that's true, but the plans that are available to you are dictated by your zip code. Mm-hmm. So that really does limit the number of plans that are available. So it makes it a little more manageable, a little less daunting. But it's also important to know, to the extent that you're an existing Medicare Advantage member, what's changing in your plan for next year, and are those changes acceptable? Because that may be the opportunity to start looking. Children helping their adults, parents. There's services available like eHealth. You can call us, you can go online, and we will help navigate you through this process. It's much less stressful.
A lot of the times I find that many people are approaching an age where they're on a fixed income and they need free services. It has been recommended that people actually start looking at these plans a year in advance before they hit that age. So tell us about some of the things and some of the considerations people should make as they are looking at different kinds of resources ahead of time.
Well, that's an excellent point. Those who are what we would call aging into Medicare eligibility, I recently became Medicare eligible myself, so I've navigated the process. And it's important that you sign up for Medicare Parts A and Part B first. Okay. When the period that you can enroll is allowed. And then, to your point, it is important to shop in advance. Now, we're right now in a period, it started on Sunday, where seniors can begin to look at options to change for 2024. We have till December 7th. Okay. It's important not to put it off. Don't procrastinate. Put the time aside now, and you'll have even a more enjoyable holiday season.
And we're almost out of time, but really quickly, give us your website where we can reach out to you for more information.
Sure. You can either contact us on the toll-free number 866-395-2104 or at eHealth.com, eHealth.com.
Thank you so much for being here with us. We really appreciate it.
My pleasure, Andrea.
And I will send it back to you.